The red button.
Yeah, I'm going to, yeah. It should have started recording, right? No? Let me try again. Yeah, it started. There's a slight delay. Okay, welcome everybody to the introduction program, sharing for Nordic Health 4.0, the Amplified Nurse. For recording purpose, my name again is Nika, and I have my partners from Business Sweden and Business Sweden with us together as well. Maybe a quick run through on the agenda for today. Firstly, I want to talk about the background on the purpose of this program, and also the concept of Nordic Health 4.0 activities in Singapore, Malaysia, and Australia. And then I'll move on to the details about the first program in Singapore, which is entitled Nordic Health 4.0, the Amplified Nurse, focusing on who are the program partners and also the program overview, so that you can actually have a better understanding of whether this program is meant for you. And also, obviously, how to register for this program. Later, I'll go through in more details about the registration form. This is very important because there will be some selection by our partners from the 3 clusters as well as the 2 agencies to help us identify who are the companies that is of interest to them. And before we end, actually, we also have a short sharing from Kasper about the Malaysia program, which is running concurrently with this program as well. There will be a Q&A, but if in between you find there's something that you really need to ask urgently, please put up your hand or actually unmute yourself, and you can answer the question accordingly. So a bit background about this. So in 2021 October, we did a sharing of the Asia Pac markets opportunities in Singapore, Australia, Malaysia, Thailand, Indonesia, Vietnam, and India. And you can actually watch a recording of this webinar on the YouTube. This slide will be shared with you later, so there's no need to kind of note down too much information on the screen. Yeah, but basically a executive summary on what happened or what is the business opportunity in Asia Pac. These are the few slides that was in the report, identifying the key areas, and also breaking down on each countries, what are the focus area, and also some numbers about the market size. So let's move on the Nordic 4.0. So based on the report, we want to actually start to have some activities in 2022 and also 2023, which we are planning for Singapore, Malaysia, and Australia. And the topic, the overarching idea is actually focusing on healthcare 4.0. This is actually a part of similar to what we understand about Industry 4.0. So there's 3 programs like I mentioned. We start off with Singapore, where we'll be focusing on nursing challenge, and that you'll be tapping on some of the government funding from Singapore Ministry of Health. And then the next program that is running concurrently will be from Malaysia. Later we'll have more details from Business Sweden. And lastly, we have from Australia, the Nordic solution in the terms of health data and digitalization of healthcare. So basically for Singapore, I'll be the host will be from Innovation Norway, and then the program in Malaysia will be hosted by Business Sweden, and lastly, Australia program will be hosted by Business Finland. So let me jump into the details for the Singapore program, the Amplified Nurse. So this program is actually focusing on the solution and system to help our nurses in their work, using technology to augment the nursing manpower and skill set. So if you are one of those companies who have a solution which can improve the nurse in terms of their productivity, in their manpowers and skill set, then this is definitely a program for you. So very importantly is to introduce who are the partners, because these partners are the key audience that will be listening in to your pitching. And also they will be the one who will be identifying which are the companies of interest. So it's very important to understand your audience in order to know how to actually plan your presentation slides. So a bit intro on the Singapore healthcare system. Basically, it's divided into three main clusters, which I mentioned earlier. NUHS, National University Health System in the west, NHG, National Health Group in the central, and on the east, we have Sing Health. So these three clusters actually cover the whole Singapore public healthcare system. And you can see that in each cluster, it is comprising of a very comprehensive facilities ranging from acute hospitals, community hospitals, primary care, specialists, and also medical school. So our partners this time around is not just the whole clusters, but it's focusing on the nursing team. So in each cluster, they have a team which we call it the group nursing, which is responsible for the whole cluster nursing teams. And under each hospital itself, there will be also chief nurse that's running the hospital nursing team as well. So what happens that we are actually partner with the group nursing, and that means that we actually have a reach to basically all the nurses in Singapore under the public healthcare system. So you can imagine that this is actually quite a good scope of audience that we are targeting. And also we are very focused and very targeted this round. Solutions need to be focused on nursing, and because the nurses will be the one listening in, and they will be the one that will be putting up funding for the projects that they are responsible for, and they have the authority to decide on. So if you are actually having some solution which are not something that the nurses is responsible for, then this program might not be suitable for you. So the other partner that we have is actually CHART. CHART was established in 2018 by MOH and EDB. Basically, this team actually is focused on helping on the so-called the projects, innovation project that helps to innovate the nursing focus not necessarily nursing focus, but the innovation project within the hospitals. And this is pretty unique in the sense that this is a centralized team. That means they have the responsibility to help every, in fact, 20 over institutes within Singapore. So projects that they handle generally are on the national level. And the last partner that we have is Integrated Health Information System, short form for IHIS. This is the IT agency for the Singapore IT support for all public hospitals. So anything relating to IT security or IT infrastructure will be dictated and will be managed by this team. So it's very important that we have them as partner because they will be going through the details of the IT requirements, and they will also be assessing the suitability of the projects, IT related areas for any project that is going on a national level, and many a time it's also even down to the hospital level as well. So I'll pause here for a while to see whether there's any question regarding all these partners that you need to know a bit more. Okay, now then I'll continue. So a program overview about this NORDIC Health, which is the amplified nurse. It's actually what you're attending today is the program introduction. We did have a session on the 20th, so this is the second session and should be the last session. So these two sessions is actually for the purpose of explaining what is the program details about, and also helping companies like you to identify whether this program is suitable for you. So it's very important that you have any questions, please ask now. If not, you can just email to your respective TPOs later. Right. At the end of this introduction webinar, I'll be sending out to all the attendees the registration form. So please fill in and submit to your respective TPO office. Do submit early so that they can review and help you to refine your answers, because this will be sent to the partners, the 5 partners that we mentioned, to have a first round of shortlisting. So this shortlisting is to identify who will be going into the next phase of the program, which is the virtual presentation program, which will happen between the 13th of May to the 17th of May. There'll be more details that I'll talk about later. And lastly, the last portion will be the physical market visit, which is the last phase of this program, where there will be a physical visit to Singapore for companies that is shortlisted from the second phase of virtual presentation to come into Singapore to meet up with the stakeholders and also to visit the actual sites. So there will be a fee imposed for this physical market program, which is 20,000 crowns. So this is a graphical representation of the program. So basically you can see this is where we are here today on the 27th of April. So after this, you'll be given some time. In fact, it will be less than 16 days, but it will be 16 days from the 20th. So you have about a week from now to submit your registration form to your TPO office. As I say again, please submit earlier before the 6th of May to your TPO office so they can help you to review and do some refinement if necessary. So 16th of May will be the closing date, and beyond that, we will be sending to the partners to ask them to help us to shortlist the companies. So there is two key phase to this program, the virtual presentation and also the physical visit. So 7 days later, on the 13th of May, will be a presentation by the healthcare providers, which comprise of all the 5 partners which I mentioned. They'll be going through the problem statements. Chad will also be going through a common problem statement, which I'll go through later as well. So today I will go through briefly on the problem statement, but it's important that we hear it from the provider themselves, which will be in more detail. But today I'll go through briefly so that you can have a brief idea and also to assess whether this program is for you. And also, of course, ITs will come in to share about the IT requirement as well. So after this presentation by the healthcare provider, then we'll have a period where we will help the companies to prepare their presentation. With a good understanding of the problem statement, and this is where on the 13th of May, please ask questions to the provider directly regarding their the problem statement, so you can refine your presentation. Again, we will be helping you to refine your presentation slides to help you focus on the information and details that is required by the healthcare providers. So between 16 to 17, that will be the time that we'll be preparing for the presentation. And sorry, between 6 to 17 June, we will be doing the presentation. So each day we only have about 3 hours, which is due to time difference. It will be from in Nordic time, probably 9 a.m. to 12 p.m. Because in Singapore it'll be 3 p.m. to 6 p.m. And each day we only can afford to have 3 companies presenting. So in total, we will shortlist about 30 companies, and each company will be given about 45 minutes for the presentation. Later, I'll go through in more detail about what information will be presented. And from here, we will actually, in this presentation by the NORDIC company, the audience will be the nurses. So it will be probably many nurses from different departments, because the clusters nursing team will help us to invite all the nurses from the various teams. So this presentation will also be recorded in case where the nurses are on duty or they are not free, then they can actually listen into the recorded version. The only difference is that they will not be able to ask questions directly. So after this presentation by the NORDIC companies, by yourself, we will then request the healthcare provider again to help us do a short listing of the company which they would really like to meet physically, face-to-face. And that is where those shortlisted companies will be offered to come to Singapore for a physical visit. And that shortlisting hopefully will happen sometime on the 24th of June. And then we'll start preparing for the physical visit. And the physical visit tentatively is planned to be sometime in September. I'll pause here again for questions. Okay, no. So it's important that we understand why are the
sorry, Nika. I actually have I had a question about the previous slide.
Okay. Yes, go ahead, Bob.
So on the 6th of May, there's a sign up for the virtual presentation program. Yeah.
Yes.
And this is probably without me having full knowledge here. Sorry. So, but the form that needs to be filled in, is that accessible by companies who want to participate?
Oh, after today, after the session, I will be sending out the form to you. In fact, today I'll be going through the form in more detail so you know how to fill in. Because filling in the form is very important. The form is not only just for ourselves to know about you, but it's mainly for the healthcare provider, that means the hospitals, to identify which are the companies that's suitable. Yeah. So later there will be a very detailed run through of the form.
No, I could foresee that. Thank you very much. Thanks.
Okay, thanks. Yeah, thanks for the question. Yeah. So before I get into the form, very important for us to understand which are the areas of focus for the nurses. So I mentioned earlier that this team called CHART, and actually in 2018, they were actually assigned with quite a bit of funding from MOH for this program called the Smart Nursing Ward. So this program is actually to help improve the productivity of the nurses in the ward using technology. And so this program has ended. So you might ask, why am I still going through this program? Reason is because that there will be new funding, although it's under a different heading, but it will still be focused on helping the nurses in their day-to-day work. And I think everybody can understand that nurses now, even before the COVID, has been quite stretched. And with the COVID, I think all the more, there are even more tasks added to them. So there is a big focus on ensuring that our nurses are, given the adequate help in their work. So it's a very good reference to understand this program so that we can actually have a glimpse of where are the focus and how funding are being allocated within the Ministry of Health in Singapore. So this program, which has ended, were eligible to all the 20 healthcare facility, which is mostly those that was listed in the table that I showed earlier. Okay, and the funding principle is very simple. Okay, the Ministry of Health will fund up to 70% of the project, and the balance 30% will be borne by the hospital. So this becomes very attractive for the hospital because they only need to pay 30% of the whole project cost. So that make it interesting for the company like you as well, because you will know that there is actually budget on the table for any program that can help the nurses in their work. And the KPI for this that program is actually 10% nursing productivity. So if the nurses can justify that there is a improve in productivity by 10%, then they can put up the request for the funding. So prior to me joining Innovation Norway, actually I was with the hospital for 15 over years. So I actually did benefit a lot from this program as well. I got quite a couple of $1 million from this funding. And then some of the other KPIs are quite standard, things like improving patient safety, improving patient experience, staff morale, and productivity within the clinical area. So let me go into the details of the problem statement. Okay, today you are hearing a slightly different problem statement from the one I presented on the 20th. Because in the past few days, I have received a bit of updates from the nursing team. So these are a revised one. For those who have attended on the 20th, I will be sending this update to them as well. So let me go through with you. So the first, so it's not 5, they have reduced it to 4. The 4 focus area from the Smart Nursing Work program is still so-called relevant for this year, because not all problems have been resolved. So these are still ongoing problems. And I also have reached out to the cluster group nursing team, and they came back to me with an additional 10 focus area. So we'll be using this problem statement totally, in total 14 of them, to help you to identify whether your solution actually meets their needs. And this will be part of the form that you need to be filled in so that it can help the nurses to identify the companies. So let me go through one by one in slightly more detail. Logistics. So regarding logistics, so it's actually talking about automation of delivery. So you know that nurses spend quite a bit of time retrieving consumable supplies and even looking for equipment, and also automating the last mile of delivery. When we talk about last mile delivery in Singapore, we are talking about from the store to the patient bed. Okay, and also managing of supply, stock taking, monitoring of stock levels. So unfortunately, all these are still part of the nurse's job to do stock taking. So you can imagine that these are actually not very value-added work for the nurses, whereby they should be focusing more on patient care. And even down to the medical waste management, collecting waste and disposing of waste is also, again, a job that nurses are burdened with. Patient care. So currently, there are quite a bit of time spent on taking vital signs on a regular basis, periodically. So this is again a very time-consuming, although a very important task. But with new technology, there are many ways to automate it, whether by wearables or by contactless technology. But you can see that here they're listed, even though there are wearables or contactless technology available, present vital sign monitoring sensors still miss the blood pressure kind of sensing. Okay. And another aspect of patient care will be medication administration that's focusing on medication adherence. So having patient taking their medication on time regularly is actually important for their recovery. Unfortunately, this is again quite a challenging task for the nurses, especially during their medication round. They could be disturbed, and also it can be quite time consuming to retrieve, to dispense the medication, and also to monitor the patient taking the medication. Another aspect of patient care will be patient transfer, whether is it from bed to chair or bed to commode or vice versa. So you can imagine, due to the size of the nurses we have in Singapore, most of them are from the Asia countries. They could be quite petite, and some of our patients are pretty big in size, so you can understand the challenges that the nurses have in moving patients from one point to another point. Next is patient and caregiver empowerment. So Singapore are very focused into home care and community care. We're trying to move patients up from the hospitals to community or to home. So access to patient education material, medical records, all these are important to ensure a smooth transition of that. And also empowering patients to be able to, in this case, move while this is more of a physical movement to help patients to be able to move around, but still at the same time ensuring it is safe for them in case where their physical body are not able to manage that. Okay, the last one from the Smart Nursing Ward is actually a nurse integrator, which is actually like a central command center. Basically, with a lot of technology coming in, we are collecting a lot of data, but this can be very confusing for the nurses, as well as we are generating a lot more alerts and also alarms. So with all this, there will be added noise and disturbance in the work. So how do we actually use data analytics or AI to help decision making for the nurses to know which are the alarms that is of higher priority for them to attend to? So moving on is actually some of the problem statements from the nursing team. So this last mile robotics and soft robotics, like what we mentioned earlier, last mile is actually from the various store to the patient bed. So this is still a challenge. We don't really have a good solution of delivering items to the patient. It can be as trivial as a blanket or a drink. So this is actually time consuming and not really making full use of nurses' time. And also the next is actually soft robotics. This is referring to as opposed to hard robotics, where it's not really the material, the contact with patient is different. So we are looking into robots to help nurses to take care of patients in a more physical manner. So smart dressing. So nurses use a lot of dressing, and it can be challenging to understand whether the wound are recovering well behind the dressing. So many a time the dressing has to be removed in order to have a good look at the condition of the wound. So there could be some kind of dressing which actually has some form of sensors to alert the nurses of the condition of the wound, that would be good. And of course, we also want to empower the patient and the caregiver to perform this wound care. So if the dressing can be easily applied, that will be another good advantage. Telehealth and remote care. So this is quite a hot topic nowadays, again, due to the needs to move patients into the community and continue to care. So, but what is lacking is actually a closed loop solution to it. So the nurses are looking into some closed loop solution, not just a one way of telehealth, but more of a closed loop where patient can feedback and also update the patient records, and using helping the nurse in terms of scheduling and prioritizing which are the patients that need more attention to. Various kind of sensing are becoming important, which I have mentioned some in the earliest problem statement. So in this case, like intelligent sensing, so there are many kind of sensing that we are looking into. It can be monitoring, like we mentioned earlier, can be some predictive, can be clinical tools, or can be video analytics. So basically, this is actually trying to automate all the various sensing within the healthcare, especially in the ward or even in the home, to help the nurses be alert of what is happening to the patient and also to the environment. Again, empowering patient is mentioned here. So empowering patient and also activating the family members to help in the care delivery. So using, in this case, this is pretty specific into some NGT tubes and also into some UTI. So these are the two common so-called challenges that they have, which are pretty tricky for the patient and the caregiver to manage, especially in terms of whether these tubes or catheter are actually being administered properly, and whether there's any infection due to it. Decision making in real time. This is also partly due to the amount of information coming in. So many times with new system coming in, nurses are required to monitor it manually. So it is important to automate all this. And also if you look at the 2B session, they also like to have more automated robots or even speech to text for hands-free documentation, and also some wearables communication devices or augmented reality kind of documentation. So job redesign for nurses to help them free up more time to take care of patients. So simple things like bed turning is taking the nurses quite a bit of time. Again, of course, it's quite challenging when the patient is pretty huge in size. You will require 2 nurses to manage it, and also that could also sometimes cause injury to the nurses. And self-medication, in this case, again, also mentioned earlier. E-learning for skill acquisition, that means for the nurses to improve their skill set through e-learning or any other form of technology that can help in their productivity or administrative work. Okay, same thing here. Regular turning of patient is mentioned again. So nurses do need a lot of help in helping them in turning patient in this case. Actually, in this area, we do have seen quite a bit of bed turning solution. In fact, I was also evaluating such solution in a hospital earlier. But I think as of today, they still have not found something that they are satisfied with. Transporting patient from one location to another can be challenging. Presently, most transportation, if it's by bed, will require two staff. One will be the nurse, and the other one is a non-clinical staff, which is a porter. So they are looking into some form of automation of using the bed or the wheelchair to transport patient. But of course, patient safety is important. This still, although it's automated, it still need to be managed in a very safe manner. So we are not saying maybe fully automated, but maybe cutting down on the number of staff required to transport patients. Clean utility is the place where the ward store all the consumables for use on a daily basis. So these are actually used quite heavily, and the stock are quite challenging to keep track of due to the different sizes of the different items within the store. So again, this is actually a manual task that the nurse had to perform every day. So they are looking at some form of automation to keep track of the stock level, as well as to automate the topping up of the items. Okay, I'll stop here again for questions. No? Okay, let's move on to the signing up. So hopefully with that, companies are clear about what are the problem statements that you are looking at. But in any case, if you find that you are not one of those that's identified in the list, but you are still helping the nurse in their work, please do sign up as well, because we will be able to, you need to so-called write in the registration form exactly which area are you helping the nurse. So that could be something that the nurses might have missed out. So a bit about the funding, I won't go into details, but just a glimpse of it because I haven't got the confirmed new funding yet. But what I understand, the funding that's replacing the Smart Nursing Ward is this funding called MOH Health Innovation Fund. Slight different from there is that this is actually targeting on a cluster and a national level. So there's two parts to here. You see 1 and 2. First one, the MOH Health Innovation Fund is targeted for ready solution or something with limited customization. That means it's a product that is actually certified, either CE, FDA, has been used by some hospitals, some track record is there. But in any case, it will still be subject to open tenders. But the advantage of coming into this program is that once you're identified, there's a good chance to be funded for the proof of value and also the scaling up to either a few hospitals or even a clusters. So the funding will allow the hospital to be able to do a proof of value. So once you clear the proof of value, I think quite easily there will be good opportunities to be implemented in some hospitals. And then it will move on to be a cluster level procurement, and that's where the RFP or the tenders will be required, because that will be so-called a scaling up to other institutions. Okay, so the other pathway is actually what we call CFC, call for collaboration. So in this case, this could be some of the solution which presently in the market there's no solution yet, or maybe a solution that need major customization due to the Singapore market special requirement. So in this case, we will go into a contractual agreement where the collaboration with the companies will be under a contract, and there will be discussion on sharing of IP, and also timeline, and also some preferential price for the hospitals that is working with the company. So any questions about this? No? Okay, I'll move on. So how to register? Let's move on to the registration process. So like what I mentioned earlier, on the 6th of May, you will need to submit. But again, please submit early so that your TPO office can help you in this form as well. And then the following that, if you're shortlisted, then you enter the virtual presentation program, which will be you will be presenting on the 6th to the 17th. So you need to present in one of these days, not every day, just one, and you'll be given about 45 minutes for the presentation. And I would suggest to have 30 minutes presentation and demo if possible. Demonstration is very useful for the nurses to fully understand your product, and try not to focus on too much of company introduction, but jump straight into your product benefits. And then we should have about 15 minutes of Q&A with the stakeholders. So like I mentioned earlier, at the max, 30 companies will be selected for this 10 working days presentation. And then the next program, which I mentioned earlier, is a physical market visit, which will happen in September. There's a fee of 20K involved. It does not include your travel and accommodation, but you include things like group lunch and transport to the sites. So if you get into the physical market visit, that means the stakeholders are very keen into implementing your solution. So I want to emphasize about this program, what you get out of this. Firstly, it's not a ticket to a PO unless we are talking about the CFC, the call for collaboration. If you're talking about the general funding, there will still need to be an open tender required. But like what I mentioned earlier, things like the proof of value, that phase will be actually funded by MOH. Okay. So there is a good opportunity to network and connect with the key user. So I would say that this is one of the very rare chance that we are able to reach out to all the nursing team within the Singapore public healthcare, and also understanding of IT and also the agency. So you have opportunity to work directly with the hospital, and also there's a good chance that program shortlisted for this will be on a national level as well. And you will, in this case, of course, you have actually received a bit of market intelligence on the problem statement. And of course, by coming into this, because the nurses will be listening, definitely you'll be creating your brand awareness as well. So let me move on to the form. So I'll be sending out this form, slight change due to the focus area, but generally it's still the same. So please firstly fill in your company name, country, and website. Contact person, destination, email, quite straightforward, and product and model. So if you have one product, simple, one form. But you have multiple products, if they are the similar, then you can still keep to one form. But if you have multiple products which are of different nature, then I will propose that you fill in different form, because some of the questions might not be the same for different products. So this is a list of the focus areas. Please identify them and tick accordingly. And also, please elaborate on why do you think that you have to fill this focus area. And question 2 is about a description of your solution. Please describe in a few sentences, not too long, because you can imagine that the nurses will have to go through many of these forms. So please make it simple. A few sentences, be very targeted, so they can easily identify what is this solution about. Number 3, productivity gain over existing way of working. So like what I mentioned earlier, one of the way of measurement in the earlier funding is to have 10% in productivity gain. So if you are able to identify here, this could be due to some of your past implementation in other hospitals. You can use those numbers to identify what is the estimated percentage gain. Okay. Then the other area to look into productivity is to look into saving of manpower, right? Whether does it save the headcount? One simple example could be like what we mentioned earlier about moving patient from one point to another point. If your product actually helps to reduce the headcount, like pushing the bed used to be 2 headcount, and now you can just need 1 staff to push the patient from point to point, then you have a saving of 50% of the headcount, or in this case, one headcount. And number 5, of course, if there's any other advantage to improve patient experience and safety, definitely this will be interesting for the nurses as well. Number 6 is about maturity of your solution, whether is it CE FDA certified, whether is it not required in some cases, whether this is pending FDA or CE, and lastly, whether this is in the prototyping stage, not for mass market yet. So of course, the last one has potential for a CFC program. If your product not really a niche product in the market, there could be other solutions out there. So please also highlight what is the advantage that you have over the competitors. Number 8 is about IT infrastructure, power, gas, and building infrastructure requirement. So if your product actually requires special infrastructure requirement, then please identify here, so that in this case, be IT or be facility, we can actually get in the right parties into future meeting, so that they can actually so-called ask certain questions that relating to the infrastructure requirement. Number 9, total cost of ownership. So in Singapore, what we focus on now, this is not just a purchase cost, but more on the cost of ownership. So in this case, we are not asking you to list out your product cost here or product price. We are actually talking about what does it cost to implement. So many a times, if you have a good solution, but if it's something that the hospital cannot afford, then actually it's of no use. So it's very important for the hospital to know at the early stage what is the cost of use, or the cost per patient day, or the cost saving. Sometimes we talk about cost avoidance, right? So you sometimes your cost could be high, but if you can justify there is a huge cost avoidance elsewhere where there's cost saving, then that could also contribute to a lower cost in overall. So that's what we mean by cost of ownership. Okay, and another thing to highlight is that when you submit this form is not shared among the companies, so there's no worry about your pricing being exposed. This is only being shared with the healthcare providers. But in any case, I'll leave it to you. If you choose not to fill in this column, we will just have to leave it to the healthcare provider to do their own selection if this information is not stated there. Last one, okay, quite important in the sense that if you find that your product will be better demonstrated with a video, please do a video of about 5 minutes, upload it, and then give us a URL link. This one definitely help the nurses to better understand your product by watching the video, right? Because you can only put in very limited information here. Okay, questions on the form? No? Okay, if not, then I'll move on the last portion, which is I will invite Kasper to share about the Malaysia program.
Yes, thank you, Nicker, and hopefully there will be some more questions to the Singapore program, which is the start for today's session.
But actually, in the last session we only have one question, so I'm surprised that there's no question from the companies. Okay.
No, I guess there will be questions afterwards individually over the email. But thank you very much, Nika, for a very good run through the initiative we are running in Singapore, and pleasure to see a number of interested Nordic companies in this part of the world. My name is Kasper. I'm acting country manager for Business Sweden here in Malaysia. and will not take too much attention out of the Singapore program, but I would like to just to highlight to you, as Nicker mentioned, that we are currently running a program in Malaysia that is targeting non-communicable diseases. And I will just very briefly explain on the high level what this initiatives entails. And also we'll share a little bit more in details. If you are interested, you can participate in our briefing session that will be held on 24th of May. But taking this opportunity and time we have, please let me just walk through you briefly on that. Nicker, if you can move to the next slide. So essentially, as mentioned, the Digital Health Innovation Challenge, or Nordic Digital Health Innovation Challenge, is the initiative we are looking at. We have been for the past 2 years actually in close contact and discussion with Ministry of Health, understanding their challenges. Obviously, there are lots of challenges in terms of the infrastructure, in terms of the funding and the quality of the service. But most importantly, and the main thing that the Ministry of Health and the entire healthcare sector is looking into is actually non-communicable diseases, which is a growing burden, and Malaysia is pretty much on the, unfortunately, on the leading end of the spectrum, having the most critical situation in the region in terms of people having diabetes. Roughly every 5th person in Malaysia have a diabetes, and increasing pace of it from 11 to 18% between the past 5 years increase. Many people facing hypertension, almost 6.4 million people in Malaysia. Hypercholesterolemia is also very striking non-communicable disease that is growing in Malaysia, roughly 8 million people. 2 million people are living today with all the three mentioned conditions, which creates a huge burden on the healthcare system. Pretty much people are going straight into the tertiary level because they are already with the very, very advanced symptoms, stage 2, 3. In some cases, even 4, which pretty much are irreversible already at that stage. So what Malaysia is doing now, both the public and the private sector, putting a lot of emphasis on early detection and mass screening. So we are in the discussion with Ministry of Health and related parties in order to identify solutions in Nordics that are capable to improve those, let's say, improve the capabilities to early detect, screening, and also working on the patient awareness and also doctor awareness. As good doctors we have here in Malaysia, everything is moving forward. There are new tools, functions, and models, and best practice for them to acquaint with. So we are looking for new solutions, proven technologies, but also innovative technologies that could be implemented in order to address those specific areas. So yet again, looking for the solutions that enable early detection, mass screening, patient awareness, and doctor awareness connected to the non-communicable diseases. And when we are saying non-communicable diseases, here obviously we mention already diabetes, hypertension, CKD, COPD, lung cancer. So the spectrum is quite broad, and we would like to keep it broad because we know there are lots of solutions, and the challenges are pretty much overarching the entire spectrum of the non-communicable diseases here in Malaysia. We have already during the early this year, Q1 and a little bit into Q2, defined the problem statements, which is pretty much that what I just explained. And by 24th of May, we will have a dedicated session to go more in details about this innovation challenge. We are actually from that point on, from 24th, we will open up an application for the companies to apply with the relevant solutions. We are in discussion and forming the technical advisory committee comprising of key opinion leaders in the fields of non-communicable diseases in Malaysia that will be evaluating the submitted applications from Nordic companies. And when evaluated throughout the European summer, we will be inviting selected solution providers for the presentations. Something a little bit in line what we have just heard in Singapore. But I will go more in details in the session, in the briefing session on 24th. But in that session, after the Swedish Nordic summer, we will select the final solution providers that will be invited to Malaysia to showcase, to demonstrate, to present those solutions to the key opinion leaders and facilitate the necessary network for the implementation. And this visit will be organized around the Q4. The final date still yet to be discussed and decided. So if we move to the next slide, Nicker, why you should consider this opportunity in Malaysia? First and foremost, we are providing as one of the benefits fast track to public and private healthcare sector accelerator programs to further develop and adjust your solutions into specific market conditions in Malaysia. Access to the global innovation network for knowledge sharing and expand beyond borders. Here basically is you will gain access to existing networks, both Malaysia and regional, in the space of further development and implementation of your solutions across the board, including Singapore, but even looking further into China, which is a very complex market. Third, we will, through those different accelerator programs and the partnerships we have facilitated for the technologies that will require proof of concept in Malaysia, we will be able to facilitate product solution trials and proof of concept. All those three translates also into obviously accessibility and networking opportunities with the various mentors, knowledge partners, key opinion leaders, experts in the field that will help you to work with the product implementation and further development for Malaysia, but even further into the Asia space. And last but not least, funding. So solutions that still require some product development and further testing we will also facilitate opportunities to partner up and team up with various venture equities and also investment angels on the market here in Malaysia. And yes, so as mentioned, if we go to the last slide, Nicker, on 24th, I will go more in depth into the innovation challenge, the process, the application, the evaluation, parameters that will be considered or the technical advisory committee will be considering when revising the applications. And also the session will give you also opportunity. We have already secured the key opinion leaders from Ministry of Health that will be providing a little bit of an overview of the non-communicable disease landscape in Malaysia, what challenges they are facing and what they're actually looking for. And just to give you a little bit more of insights information on that. We will I will be capable, our team will be capable to share some more information and even invitation for this webinar briefing session for your consideration. If you feel that this is something that you can run concurrently with the Singapore track, then we will be very much happy to welcome you on board for this particular initiatives as well. So yes, that's very briefly about the Malaysia initiative. Thank you for your attention, and hopefully we can see some of you participating on the 24th of May to get to know more details. Thank you so much.
Thank you, Casper. Yep. So just to add on to what he mentioned, meaning on the timeline. So we say these two are running concurrently, but the last portion of it in September or all the way to December could be the Malaysia program. So we have not really defined exactly when is the Singapore physical visit. So it all based on the company that is submitting for these two programs. If we find there are a lot of similar companies submitting for both programs, then obviously we want to pack these two physical visits back to back, so the companies can come to Singapore and then move on to Malaysia in a single trip. Yeah, but again, these two programs are pretty different in certain area of focus, but again, there are some crossover, right? So we will be sending out the invitation for the Malaysia webinar shortly within this probably 1 week. Yeah, because the webinar is only about a month away, 24th of May. So again, back to Q&A. Any questions from the floor? Okay, no, if not, again, I will encourage you to pose any question back to your TPO office. Nicholas,
Yeah,
you have something to ask? Yeah, or something to add on?
Yeah, no questions, but thank you, Nika. Thank you, Casper. Thank you, everyone, for joining this call. My name is Nicholas. I'm part of Business Sweden, but I would like to thank everyone here for joining this meeting. I would like to highlight that, again, this is a very unique opportunity because you gain real good direct access to stakeholders. And also, finally, one last note for in terms of logistics, Singapore and Malaysia, I believe, has opened up. Singapore is for sure opened up. So again, any travel to Singapore, there's no quarantine, there's no requirements of that sort. So basically, all you needed to have is just your vaccination, and then you can come to Singapore. Again, take this opportunity to see it as a gateway into learning, and also getting to know who the stakeholders are, and joining us for this program. So really happy for you to listen in, and just feel free to reach out to us trade organizations, as you can see from your respective offices, Finland, Sweden, and Norway, and then just reach out to us in any time. Thank you very much. Back to you.
Hey, thanks, Nicholas. Yeah, thanks for highlighting. Yeah, Singapore is pretty open up to that extent, and especially I think by September or later part of this year, I believe they will apply the same for Malaysia as well. Okay, so thanks everyone.
I can just compare that, yes, that Malaysia is equally open as Singapore. So, and also moving towards the Q4 when we are planning for those physical visits, I guess the situation will be even more clear. But so as of now, no restrictions. Hopefully, the situation will not escalate. I will see very positive trend in Southeast Asia right now, with the declining number of cases and restrictions pretty much disappearing. So we have some question from Boy.
Yes, Boy.
Yes. Yep. Thank you. No, I'm probably repeating myself here, Nico. Sorry, but sharing of the material, presentation, the form, and all of that, would that come post this session here, or how will that?
Yeah,
okay.
It will post this session, but the information is for those who attend only. So please
Sure.
do not forward it to another company, because we just want to keep track of the company that's attending this webinar.
Good. No,
Okay.
Thank you.
So we will send out the slides as well as the application form, obviously, for you to fill in and submit accordingly. Okay, the slides will be slightly simplified because some of the materials are actually from the healthcare providers, which we have not got the rights to share openly yet. But the details will be shared, like what I said, by the healthcare provider themselves in more details. But there should be enough information for you to assess what are the problem statement that is listed there. But in any case, if you have any more questions, please do come back to us. Okay. If there's no further question, thanks everyone for attending. Have a nice day ahead. Bye-bye, and looking forward to your submission.
Yes, thank you.
Thank you. Bye-bye.
Bye-bye.